My name is Rebecca Roesslet, and I am a senior planner with the Columbia Boone County Department of Public Health and Human Services. As a local public health department, we have been doing community health assessments for many years. It is our role to collect public health data and share that with our community partners. So in the past, for example, we would pull together heart disease rates, diabetes, tobacco use for Boone County, and then we would put it into a usable format and we would share that with our community partners, and they would then be able to use that information when they were making programming decisions and doing their own planning. What is different now from years ago is that in 2013 we adopted a new framework for completing these community health assessments. And the model that we used, it's called Mobilizing for Action Through Planning and Partnerships, or the MAP process. And the main difference between the MAP process is that it calls for a very heavy focus on community input. What do they want the larger public health system to focus on? What are their concerns for the health of Boone County? So that's the main difference in this process that we started in 2013. Our behavioral health action team, they were really looking at reducing the stigma around seeking behavioral health services. So we were able to use that information to develop the Look Around campaign, which is a behavioral health awareness campaign that is focused on youth and adults that work with youth. And it has been now disseminated throughout all of the public schools within Boone County. One of our other programs that has crossed over two of the action teams is our Live Well by Faith program. We noticed during our community health assessment that although Boone County as a whole is a pretty healthy community, we have some significant health disparities between the health of our white population and our African American population. And our Live Well by Faith program has been very successful. This is a health and wellness program that works with the historically black churches in Columbia to implement health ministries within those churches, and they're seeing significant health improvements in those who are participating in that program. Their blood sugar is lower, their high blood pressure is better. So that's an example of one program that we were able to develop as a result of this health improvement. Today, what we're seeing from the focus groups fairly consistently is strong support for our parks and our trail systems. Those are real positives, as well as our wealth of medical resources that we have in Boone County. So all of this information then is used to identify our strategic issue areas. And in identifying our strategic issue areas, what we're looking at is what things came up consistently in all four of those assessments. What did we see across the board? And we came up with 5. Safe and healthy neighborhoods, access to health care, behavioral health, healthy lifestyles, and health disparities. So after we have identified the strategic issues for 2018, then we will move into the formulate goals and strategies, and that's where we develop the plans to work on those strategic issues. After we've done that, then we move into the action cycle, which is really the boots on the ground work of carrying out the activities that were developed as part of the plan. At this point in the 2018 process, we have identified 6 strategic issue priority areas. Those 6 are affordable housing, community engagement and inclusion, drugs and alcohol, medical and dental, mental health, and safety net basic needs. As a longtime resident of Boone County, I am more excited about the recognition of our community members, that they feel that they're being heard by those who provide health services to them, that they have a voice in the process. If our data tells us that we really need to be focused on one thing, but our community says, no, we think this other issue is having a bigger impact on our health, we need to be able to listen to that and know that then we can work with the residents that we serve to help improve their health and the health of their community.